We're here today with Judy Gilman. Judy, tell us why you're here today.
Well, Mike, I'm here to talk about Bio's Life Slim. And as you can tell from the name, this has something to do with weight loss. Bio's Life Slim. It's not just got something to do about weight loss, but it also is an excellent all-natural nutritional supplement for diabetes and improving cholesterol. So not only does it help people with weight loss, really fat loss,
Sure.
helps with diabetes and cholesterol as well.
Now, there are a lot of nutritional supplements out there. I've seen a lot of them. Now, tell us why this is different. And of course, with you having a medical background, can add some credibility to this product and what you're talking about.
Well, that's a great question. And what, to me, makes Bio's Life different, and we know, there's tons of treatment out there for weight loss and diabetes and cholesterol. And we don't say we're better than other products, but what we have is really great science behind this product. That's one of the things that makes me so comfortable as a healthcare provider, as other healthcare providers are comfortable with this because of the research. It's all natural. There's no side effects. And there's no stimulants, which is very important when you're talking especially about weight loss. So many people are worried about that. And as I said, we also address diabetes and cholesterol. And what we do with Bio's Life Slim is really reset the metabolism. So we're stabilizing the hormones insulin and leptin, which is a hunger hormone. So it's very unique.
Now, and again, I'm not a nurse practitioner like you are. How is this different from prescription medication that's out there? How does it compare, or how is it different?
Well, again, it's all natural without side effects, which unfortunately a lot of prescriptions do. As you said, I'm a medical provider and obviously have prescribed a lot of medication. And especially related to cholesterol, I just want to address that. The prescription drug statins are very effective for cholesterol. But with our all-natural supplement in our clinical trials, double-blind, placebo-controlled clinical trials, we find that Bio's Life Slim lowers the bad cholesterol, the LDL, 31% on average, which is very similar to what people get with statin prescription medicines. And also the HDL, which is the good cholesterol, goes up 29%. That's unheard of. There's no prescription medicines that can do that, so it's very, very beneficial that way. People who have problems with triglycerides, the fat in the blood, on average lowers that 40%. And in the meantime, it's stabilizing the blood glucose, and people are very gradually losing weight.
I have a few more questions I want, but let's tell people about how they could find out more about the product, and then I'm going to get to some other questions. And you also have an offer that you'd like to let people know that are watching this, where they could have an opportunity to get this product.
Yeah, exactly. I'm glad you mentioned that. People can either contact me through the website, just an email there, or you can call the number that you see on the screen. And if you mention the code 444, if your viewers mention the code 444, they're going to get a 15% discount and a free shaker cup.
All right.
So,
one of the things that I've been thinking about, I have young children, and I also have parents that are older. Is age an issue here? Can it be for the young and for the elderly, as well as those in between, like me?
Yeah. This is one of the really great things that I like about Bio's Life Slim. We have not only an epidemic of obesity across the country, but we have an epidemic of obesity in children. This is safe for children. It's not only safe for them, it tastes good.
Well, that's a big deal. I have a 6-year-old, so
exactly.
I know how that goes.
It tastes good. And as far as any age group, it's just very, very safe.
Well, tell us, how is Slim taken then? What is the procedure? How do you ingest it?
Yeah, well, it's very simple. You just take one little packet and 8 to 10 ounces of cold water, put that in, put the Slim in, shake it up really, really well. And you just drink it twice a day before your 2 largest meals. So simple. It has this delicious, creamy orange flavor. A lot of people say it tastes like an orange Julius to give people a sense of the taste. So very simple, just twice a day before 2 meals.
If we could pass my 6-year-old's taste test, I'm sure it would be good, and
exactly.
I'm sure he would like that. Tell us about the product and where you see this product going, because it sounds like, from what you were telling me, you're changing some lives, and there are some very good success stories from this.
There are. And as a nurse practitioner, after specializing in family practice for 13 years, then I during that time, I developed a very large patient population of people with diabetes. It's just always been a passion of mine. And that led me to the next 15 years specializing in diabetes. So what I really see is a huge benefit. We have a massive epidemic of diabetes in our country. Type 2 diabetes is the most common. This lowers blood sugar levels. People are able to often reduce their prescription medication, which often cause weight gain. So I really see this primarily being beneficial for people with diabetes. 80% of the people with diabetes have some kind of cardiovascular disease. So they have issues with their cholesterol and triglycerides, so it's beneficial for that. Almost everybody with type 2 diabetes is overweight. So again, this one little packet does so much. It addresses all three of those issues.
And let's tell people again about the special offer that you want available so that people can have an opportunity to try this product and maybe change their lives.
Exactly. Again, call me or email me on my website and get a 15% discount and free shaker cup, and I'll answer all the questions that they would like to know.
It is rare that, and we mentioned when we opened this segment that there are a lot of products out there and you can't help but see them almost everywhere. But it is rare where you see someone who is in the medical, a nurse practitioner like yourself, being able to talk about these issues head on and answer questions, true to life questions. And I know that's one thing that you do with this product, and you encourage people to contact you and you tell them the situation and it can help maybe change their lives.
Yeah, absolutely. There's no doubt about that. What the research is what really impressed me. When I first learned about this product, it was in one of my medical journals. And it talked about diabetes and cholesterol and weight loss, and I thought, well, I need to check this out. And of course, I want to be very careful of my professional credentials.
Yeah.
So I researched the company, which has been around since the beginning of last century. I researched the product, 20 years of safety and research to back up the product. So medical professionals like myself feel very comfortable. And you'd be surprised, Mike, there's so many of us as healthcare providers, when we need to have a treatment, we would prefer ourselves to have an all-natural treatment. If there's good research, it's effective, and it's safe. And so we not only feel comfortable recommending it to our patients, but we take it ourselves.
That is true. It seems like there's a pushback a little bit by trying something that's all natural, although really that's the best thing for all of our bodies all the time, is to try to stay away from those things with the side effects. I wonder why that is, that everybody seems, maybe they think it's too good to be true. Is that probably what it is?
Sometimes that's true. And as traditionally trained medical people, sometimes we're not as open as we could be to nutrition, although we as healthcare providers talk all the time about we need to eat better and we need to be physically active. We don't really use nutrition to its full benefit. And so I've kind of come full spectrum myself, from being the prescription writer to finding a lot of natural treatments. Not that there aren't prescriptions, there's a very good role for those at times we need them. But we also need to realize that nutrition is very important for our health.
I really enjoyed talking to you. I like this approach where I think you can feel very comfortable looking at this product as something that can be very valuable. Tell people again how they can get a hold of it and how they can get a hold of you.
Yeah. Again, just go to my website, send me an email, or just call the number that they see on the screen, and I'm just happy to answer questions. I feel very comfortable in doing that.
Judy, I really enjoyed meeting you, and thank you for being here today. And we encourage everybody to give you a call and reach out and see if this could be something that could really help them.
And don't forget to mention the 444, and they'll get the 15% discount.
And the shaker cup.
And the shaker cup.
There you go. Thank you again very much for being here.
You're very welcome. Thank you.